Hi, thanks for tuning in to episode number 73 of the Doctor Podcast Show. We'll have a great episode today with a great guest, and I'd really appreciate it if you could subscribe and follow Doctor Podcasts so we have additional great guests like we have today. And also, please like and repost this episode, which I'm sure you'll love. Today, we're talking about a very, very important topic which has saved the lives of hundreds of thousands, if not millions of people over the last 7 decades or so. We're talking about cardiac or heart pacemakers. And we have one of the world's leading experts as the guest today, Dr. Robert Kowal, who is a board certified cardiologist, also board certified in internal medicine. And he specializes in cardiac electrophysiology, which is what keeps your heart ticking. And he'll tell us all about that. Dr. Kowal previously practiced at Baylor Heart and Vascular Hospital and served as the co-medical director of the electrophysiology and best care clinical integration of Baylor Scott and White. He's formerly the chief medical officer and vice president of medical affairs at Medtronic, which is one of the world's largest medical companies. He was in charge of business development and strategy within the cardiac rhythm management department, the diagnostic services and ablation solutions businesses at Medtronic. He's currently the vice president and general manager of the Medtronic Cardiac Pacing Therapies division. If you're not familiar with Medtronic, although most people are, it's the leading healthcare technology company in the world. It's celebrating its 75th year in business this year and providing innovative, great products for patients in cardiology, diabetes, and numerous other medical and surgical specialties. In total, Medtronic technologies and therapies treat more than 70 different health conditions. And in the last year, the therapies have improved the lives of about 78 million people around the planet. That's about 2 people every second. Medtronic operates in just about every country in the world, and its annual sales are over 30 billion. That's billion dollars annually, and it employs over 95,000 people. So it's a huge company. It's doing incredible, innovative work. And today we're going to discuss one of its most important products, and that is pacemakers. So, Dr. Cal, thanks very much for taking time to join us today
My
on the
pleasure. Thank
Doctor
you for
Pod.
having me on. Yeah, it's
Yeah,
great.
this is awesome. So, tell us what cardiac electrophysiology is and how you became interested in that.
Yeah, no, it's great. It's not that well known. It's a subspecialty of cardiology focused virtually entirely on arrhythmias. So the way I like to think about it, you have a heart rate resting, you have a heart rate that goes up exercising. Cardiac electrophysiology is the study of when that heart rhythm is too fast, too slow, irregular, or uncoordinated. Because the heart rhythm is what kind of drives your heart's ability to pump. Think of like the motor of a car. This is the spark plugs. And just like your car can get out of sync, the cylinders, likewise, that can happen in the heart as well. And that can lead to some really life-threatening complications where you either pass out and hurt yourself, or it's rhythm problems can cause sudden cardiac arrest. And so the field is actually really fascinating because it spans a whole spectrum of these problems. There are things that make people feel really bad. And it's a privilege to do the work, or when I was in practice, because you can really make people feel better, oftentimes pretty quickly.
Right. I'm an ophthalmologist and I have many elderly patients who have pacemakers because of heart arrhythmias. So why do people get heart arrhythmias? Why doesn't your heart just keep ticking regularly and properly? What happens? What goes wrong? And
Yeah, I mean,
who's at risk of that?
yeah. So if you think about it, the heart is beating, let's say 60 times a minute at rest, maybe going up in the 120, 30, 40 when you're exercising for your entire life. This is hundreds of millions of heartbeats, right? And the upper
Right.
chambers of the heart have to activate. That has to send signals through specialized, what we call the conduction system, these specialized heart cells that go to the lower chamber. And that has to be exquisitely coordinated time after time after time. And so it's not surprising that that can get out of sync or have problems. And so the most common situations are, with age, the conduction system can get diseased, and that can lead to very slow heart rates, or something called atrial fibrillation, which is an irregular rhythm of the upper chamber that leads to kind of fast, slow, and irregular rates in the ventricles, the pumping chambers of the heart. And then the other thing is, for people who have suffered heart failure or a heart attack, they can be at risk for what's called sudden cardiac arrest, where instead of having slow or irregular rhythms, you get extremely fast, unstable rhythms. We call them ventricular tachycardia or ventricular fibrillation. And those, if not treated within seconds to minutes, can be lethal. And so there are a variety of different things that can occur in all the chambers of the heart. And some are age-related, some have genetic causes, some are related to the presence of coronary artery disease. So there's a whole variety of presentations.
Right. So if your heart's not pumping rhythmically or regularly, the blood doesn't get moved around your body. Your brain eventually doesn't get enough blood, doesn't get enough oxygen, and then you faint and collapse. Is that what
Yes,
happens?
100%. Yeah. So in the setting of too slow or irregular heartbeats, right, that's the problem. You don't have enough cardiac output to keep you from passing out or from feeling very lightheaded or dizzy. Sometimes just the sheer symptoms related to, we all feel skip beats or palpitations. If that's going on continuously, it's a very uncomfortable feeling. And then likewise, if it's way too fast in the setting of these life-threatening arrhythmias, there's just not enough blood flow to sustain brain function or function of the body, and that's life-threatening and urgent.
So how are heart pacemakers used to treat certain types of heart arrhythmias?
Yeah, so when you look at the subset of patients whose heart rates are too slow, um, that's where a pacemaker comes in. And I think the way to best describe a pacemaker is a fancy clock. So it's a device, and we have a couple different types, some that sit entirely in the heart called leadless pacemakers, and the traditional kind that there's like a generator that's the size of an Oreo cookie that sits in the chest under the skin with wires that go through the blood vessels and into the chambers of the heart. And what it really does is it just sits and watches your heartbeat. And a physician can set the timing parameters. So let's say, again, 60 beats per minute at rest, let's say 120 beats per minute with exercise. And the device looks and it senses the electrical activity of the heart. And if it sees a normal beat, it sits and does nothing. But if a second goes by and it hasn't seen a beat, it can pace each of the chambers in sequence to restore a normal heartbeat and give the heart, the rhythm it needs to pump.
So it sends an electrical signal into the heart muscle, reminding the heart to beat and pump the blood.
Yeah, exactly.
That's amazing. Um, what was the first pacemaker like? I've heard and read that it was a huge device and
Yeah.
very awkward. Can you tell
So,
us
so
about that and
yeah,
who?
so originally, so this is kind of the foundational story of Medtronic, which is interesting. So originally, pacemakers were these external boxes that were AC powered. You had to plug them in with
AC,
wires.
you have to plug them into the wall in your home.
Exactly. And
Wow.
so they were really used post-operatively for people who developed slow heart rates post-operative after cardiac surgery and then would recover over time. And so this is the 1950s. Earl Bakken, who was the founder of Medtronic, was working with a cardiac surgeon at University of Minnesota, Dr. Lillehei, who was very famous at developing not only bypass surgery, but transplantation surgery as well, just a foundational person in the world of cardiac surgery. And they were dealing with the fact that these were cumbersome. And if there was a power failure, you really risked catastrophic outcomes. And so Lillehei asked Bakken, who was an engineer, could you do something that removed the AC powering? And so he built a device using a circuit design that created a metronome type function and used a battery power for that. And that was external. So wires would come out the neck or the blood vessels through the skin and hook up to this to replace this massive box that was sitting, bedside. So that was the first thing. And then came after that the idea of getting this fully implantable. And the first devices were almost the size of a hockey puck, if you will, would sit below the skin, and originally weren't programmable. And gradually these devices have changed to create programming capability, the ability to monitor, and shrink down in size and add battery longevity dramatically. We could kind of go into more of those capabilities that have occurred over time. But that, that's going back 65 years. 1960 was really the first implantable pacemaker, and it started this whole kind of medical technology space.
That's an amazing story. So they basically shrunk it in size, attached batteries, and just made it more convenient and portable for patients. Now, I've read that Medtronic is the leader in pacemakers, and that's about a $4.5 billion market. So that's a huge market. I noticed that a lot more of my patients have pacemakers, especially elderly patients. Can you estimate how many people in the USA have pacemakers? Is it a few 100,000?
Yeah, so if you look across all the companies that make pacemakers, I think on average in the United States, probably between 450 to 500,000, maybe a little bit more, get a pacemaker each year.
Wow.
And then actually maybe closer to 600,000 if you include everybody. Then, I mean, these devices can last, 10 to 15 years, sometimes even longer. So a lot of people out there living with pacemakers, and the whole idea is it allows you to live a normal life and get back to the things you want to do without the fear of passing out or feeling fatigued. And so there are probably at least several million people who have pacemakers in the United States.
Oh, that's pretty amazing. They last that long, 10, 15 years?
Yeah. So, the original devices 65 years ago were huge, right? These hockey puck sized devices. And with improvements in circuitry and battery technology, those were lasting 2.5 years. Now, the typical device that sits under the skin is the size of an Oreo cookie, 1/10 the size, and has a 15 plus year, 14, 15-year battery life on average. And then we've developed, and some others have as well, these leadless pacemakers. The pacemaker sits entirely in the heart. Those are another 10-fold smaller. So you're looking at over 65 years, 100-fold drop in the size of a pacemaker.
That's pretty amazing. That's
Pretty
your
incredible when you think about it.
pacemaker,
Yes,
right?
correct.
Yeah, that's an incredible device. Now, how did you go from wires from the pacemaker that's implanted under the skin, and these wires had to go inside the heart, to having something without wires where this thing is just sitting inside the heart?
Yeah, really, look, it's largely a story of kind of progressive improvements over time, step function changes in capability, battery longevity, the ability for these devices to send signals and be reprogrammed over time so that they're not static, they're dynamic and respond to a patient's needs. The ability to create kind of longer durability through battery technology, and then ultimately the recognition that you're most efficient if you're in the heart and you lower the side effects of these. Now, putting these in come with some risks and complications over time, and
Right.
the least number of the more you can reduce the number of components, the better it is. So the ability to get a device like Micra into the heart drives down the risks related to it and allows people to just gain the benefits that much more. What allowed us to do it was really three things. One, just incredible ability to improve battery technology so that something, under 1 cc, 0.8 cc's can produce a battery longevity of 16 or 17 years. I mean,
It's
it's just,
amazing.
when you think about, I have a picture on my phone, I should just show everyone, of this next to an AirPod. Micra is smaller than an AirPod, and yet it can function in a body for almost 2 decades. The second is the miniaturization of circuitry. So you had to take, the original pacemakers had circuit boards that were huge. Now we've miniaturized that to really a tiny, if you drop these things, you can't see the circuitry if you drop it. And then those also are incredibly low power circuits, right? So if you think about a phone, you're trying to do as much functionality as you can, and you can recharge it at the end of the day or in 2 days.
Right.
This, you've got to eke out every tiny bit of power you can get so you can last as long as possible and save a patient from another procedure. So that's number two. And the third was the ability to create what we call fixation, the ability to have it stay in a single spot in the heart without moving for that
Right.
long. So you add those three things together, and those were the capabilities that then allowed you to kind of bypass the wires, the device under the chest wall, and actually get it into the heart where it belongs.
Right. Where exactly does the Micra device, the pacemaker, attach to the heart? What part of the heart is it attached to?
Yeah, so it sits in the ventricle in a specific spot called the right ventricle in the septum. So this is the part that divides the two lower chambers of the heart. That allows it to activate the heart in a fairly symmetric manner, and it positions it in a very safe position where it's not at the walls, the edges of the heart, and so we fixate it there.
How does it attach? Are there like microscopic hooks that hook into the heart muscle, or how
Yeah,
does that work?
there are small tines. So they're nitinols, so they're very flexible. They come out of the device and then curve back on themselves and kind of grab the tissue, but they grab it very gently.
Right.
And they are flexible and can move. And the beauty of nitinol is it tends not to fracture. So it allows for a good fixation, keeps the device up against the heart wall. And in the center of it is the electrode that stimulates the heart. But what the beauty of the fixation is just millimeters away from the electrode, so they don't interfere with each other. And now the second aspect is, normally in a pacemaker, in a traditional pacemaker, to sense a chamber, you have to have a wire or a lead in that chamber. What
Right.
we've done with Micra is the ability to not only sense the ventricle electrically, but it can sense the upper chamber, the atrium, from the ventricle just by mechanical movements. So now you can sense two chambers in pace one, but you don't have to have hardware in both chambers. And that's another big breakthrough that we brought to the Micra product line.
That's incredible. So you've been a practicing cardiologist and electrophysiologist for many years. I'll bet if somebody told you you'd have this 20 years ago, you would have said, "You're nuts. This is science
Yeah,
fiction."
these were things that people dreamed about. In fact, there were designs in the 70s of kind of micronuclear reactors driving these devices, but there was no real way to do it.
Right.
And so it really is the culmination of kind of the ideas with this kind of overlap of technology that allows us to do it.
Right. So it's evolution of several different things, and they come together and you get this. And the Micra doesn't get detached even though the heart is beating all the time,
It's
60, 70.
extremely rare. So when you look, the chance of that moving from its original implantation site is our statistics now are under 1 in 1,000. Very small.
Very tiny. And how do you get it into the heart? Is it going through a blood vessel in the neck or some other place?
Yeah, so right now the dominant approach is through the femoral vein in the leg.
Oh, okay.
It goes up through the vein system, up then into the heart. It can also be done through the jugular vein in the neck. And so we've introduced that as well. Really, that allows the flexibility so that if someone has kind of spinal curvature problems, it's a lot easier to go from the neck. So there
You
are a
can
couple of
go
ways to do it.
two approaches. That's great. So
Yeah.
it fits just about everybody. Now, is the doctor doing this procedure visualizing this by x-rays or some other technology so they know they've got it in the right spot?
Yeah, it's a great question. So just like traditional pacemakers, usually fluoroscopy is the approach of choice. And usually very small doses. So these are not kind of dangerous doses to someone that's, minute or two. The other way that the heart can be visualized is through ultrasound. So there are some people using various modalities of ultrasound to know exactly where the micro device is sitting so that they know they've delivered it to the right spot of the heart that they want to activate.
Right, and that has no x-rays at all, so
None at
that's
all. Yeah, correct.
extremely safe. How long does that procedure take approximately to
Yeah,
implant a micro?
it's a great question. Uh, First off, right, you don't want anyone rushing through these things. But the beauty is because it's
Right,
one access point, you don't have to then suture closed kind of a surgical incision. And you get direct visual, you're only putting in one device. On average, they're about 20, 25 minutes to place. And so for a for an elderly person who has other problems or illnesses, these can be done relatively effectively with limited amounts of anesthesia, which is
just
good. You don't.
mild sedation,
Yeah,
basically. Yeah, it's similar to my cataract surgery, very
yeah,
mild sedation.
exactly. And
And
there's a lot of,
what's
as you said, there's a lot of overlap in that kind of patient population.
right? And what's the recovery like? Can people resume their normal activities the next day, or how long does it take?
Yeah, so usually people are first recovering from any mild anesthesia. Secondly, the venous access site probably needs an hour or two of rest and a suture that can come out. Um, if someone's getting a traditional pacemaker with wires, you probably want them to restrict some arm movement for, day or two to a week or two. With micro, really those restrictions aren't there because the device is in the heart. So people are up and walking around within a couple hours and getting back to their lives. For a lot of them, if their heart rates have been in the 30s and now suddenly you give them a normal heart rate, they're kind of raring to go and feeling well. So
They basically leave the hospital and run a marathon.
well, yeah, maybe not a lot of running marathons in this population, but some are.
Right.
Some
But
are.
it allows them to restore a more normal
I mean,
life
that's
because
the
they're
key.
getting the
We want
blood
to
flow.
get people
Right,
back to doing the things they want to do, and feeling better.
right. So now is Micra replacing all of the other pacemakers that Medtronic made over the years, or is everybody a candidate for Micra, or do
So not everybody's a candidate at this point. It really it works for the people who have a specific subset of the arrhythmias called heart block, and those with heart block with normal rhythm in the upper chamber or with atrial fibrillation. Those who only have what we call sinus node dysfunction are better served by traditional pacemakers at this
I
point.
see.
So that's a subset. And so and then the other thing is because they're smaller, sometimes there's some trade-offs in the capabilities. So the full nature of the features you can offer in a traditional device can be a little bit broader. And so really the beauty of this is you can give a patient the options, right? So any given patient, depending on what their diagnosis is and what their needs are, some are better off served by a leadless pacemaker, some are better served by a traditional pacemaker. And now we've also taken the traditional pacemakers and added a capability called conduction system pacing, where rather than just putting a wire into the heart anywhere, we specifically target the heart's internal electrical system called the conduction system. And that's a better way to pace if you need wires. So really the beauty of this day and age in pacing is no matter which device you need, there's an option for you depending on your issue. And so now when you look at it, leadless pacing is growing at about 20% or so of pacemakers are leadless. And we think as the capabilities broaden, we'll see even more of that as
Right.
well.
As the technology evolves, absolutely, more and more.
Absolutely.
Now, how long has Micra been around? When was it first
So
used?
we just celebrated the 10th year of the first patient to receive it. In the US, I believe it was 2016 when it was FDA approved. So we're coming up on, in a couple years, on 10 years of approval. And it was interesting that from the time of approval to the time that Medicare decided to reimburse was actually incredibly short because of the understanding of the value of kind of simplifying the pacemaker, getting rid of the wires, and removing some of the, the low but present complications related to traditional pacing.
Right. Now, is the Micra MRI safe? Like if you're
Yes,
having an MRI, so there's no
absolutely.
metal in it or parts that are
Well, there
not.
there is, but it's not ferromagnetic. So it's titanium, nitinol. So you can undergo an MRI. It doesn't create a lot of shadowing. The MRIs are actually quite nice. You can be cremated. You don't have to remove it for the patients you have that would prefer cremation. So it's a nice device in that way.
Yeah, it sounds incredible. Now, what role did you play in the development and the evolution of the Micra?
So relatively tiny compared to the engineers who did this. So
Right.
I was particularly interested in the technology as a practicing electrophysiologist and was in the trial that led to its approval. And then I went as a physician representing Medtronic to review the data when it was presented to the FDA. And then once I got to Medtronic, was heavily involved with kind of getting to the next generation, and we're working on future generations now. So it's been exciting to be a part of such a cutting edge change to what is a relatively old space, right? It just shows you can keep redefining these spaces,
Right.
these device capabilities.
Now, can the cardiologist, the electrophysiologist, test the pacemaker from time to time to make sure it's functioning
Yeah,
properly and triggering
absolutely.
properly?
All our pacemakers, whether it's Micra or traditional ones, um, can be programmed. So you can actually take a device with a programmer head, put them over the devices, and you can communicate. And that does a couple of things. One, you can establish information on the status of the device, how well it's working, how long the battery has left. And the devices will signal when kind of the battery is coming to a point where it needs a revision.
Does the
Secondly,
patient get that signal or you
well,
check it?
I'll get to that in 1 second.
Okay.
So secondly, you can change the parameters. So I can tell it, instead of pacing at 60, I'm going to pace at 50. And if you exercise, it's going to go up to 130 instead of 120. So all these things can be changed. And then thirdly, they gather information about what's going on in the patient. Are there any new rhythm problems? Is there, some of them can detect, changes that suggest heart failure or the emergence of the rhythm atrial fibrillation. So you can actually gather other health information as well. And so all of these can be done with the patient in a doctor's office, but there are also abilities to get the information remotely from home. So a person takes home with them a monitor that then sits over the device, and usually then through your phone or a bedside connection can send information to a physician. And then the line of devices that we have that sit under the skin can connect directly to your phone and then send a signal if there's a problem. So
Wow.
we've had people who kind of develop new onset atrial fibrillation. The device detects it, and then they get a call 20 minutes later from their doctor's office saying, we saw you went into atrial fibrillation, and they might not even know.
Right.
So the monitoring capabilities are pretty sophisticated.
So it's not only sending a signal for the heart to beat, but it's also monitoring what the
Yeah,
heart's doing. That's
exactly.
critically important because things change. That's
Yeah.
pretty amazing. And there's an app for that, huh?
Yes, exactly. Exactly.
There's an app for everything these days. That's incredible. Now, you mentioned the Micro's been around 10 years and the life expectancy of the device is maybe 15, 17 years.
So yes.
How do you know when it's time to change the battery?
So all pacemakers create signals that say, look, this device is within a 6-month period of time of when you want to change the battery. And we design those signals so there's plenty of leeway. And then what we suggest is that patients get remote monitoring from home or coming in the office in an interval of every 3 months or so. And that's kind of the standard that the Heart Rhythm Society, that really are the experts who kind of suggest what these guidelines should be, suggest. And so you build in the safety and leeway. And then, it used to be, like I said, patients would have to come to the office all the time. Now if someone's feeling well, they almost never have to come to the office for their pacemaker. It can all be done remotely from the standpoint of monitoring.
That's pretty amazing. A thought just occurred to me with, the wild internet out there and hacking.
Yeah.
Is it possible for a pacemaker to be hacked from some devious person on the internet?
Yeah, it's a great question, and ones that come up. I think there was an episode of West Wing or something like that where there was, hacking
Oh,
of a
really?
defibrillator. In fact, we've never seen a recorded episode where this has occurred. And by design, we put in a lot of safeguards so that the device can't be changed unless it knows it's a Medtronic programmer that's operating it. And there are a lot of safeguards built into the app, for example, so that the app is really a pass-through of information. It's not actively programming or doing anything to the device. And
I
so
see.
the other thing is we have a team, a cyber team, security team that's constantly looking for changes that would say, we need to change a certain, some software to make it safer, as there are threats that come in. And we also work with third parties that are constantly testing our online data sites to make sure they're as safe as possible. So
Right.
like I said, you can never say never, but we know of no episodes where a pacemaker has been programmed in a way that wasn't intended by someone who was interfering from the outside. And what we'd say, the other thing is, to do that, you have to be so close. There's other ways of harming someone if you wanted to. And
Right.
it's a morbid way to think about it, but in fact, I had a patient, interesting, this is a true story.
Yeah.
She had a very slow heart rate and was passing out. She was a cybersecurity software engineer, and her husband was a hardware engineer. And, as she looked and reviewed all the information, we had her talk to engineers, her conclusion was the benefits of this therapy so dramatically outweigh a risk of someone interfering that it would
Right.
be crazy for me not to get the benefits of what I need. And I think that was the really healthy way to look at this.
Right. Yeah. The benefits tremendously outweigh any
Yeah.
risk. So nobody can steal your iPhone and change how fast your heart beats.
No, that is not a possibility. No, that's not a capability we have.
Right. Now, let's say 17 years go by and the Micra gives you a warning that you've got 6 months left. You have to remove the entire device, or can you just replace the battery, or how does
So
that work?
So if you look at the traditional devices, the way you manage that is you make a small incision over the device, you use the original leads that are in place and replace the device, and then suture closed. With Micra, it's designed to either be removed if you want to, or leave it behind, because it's tiny. It's less than 1 cubic centimeter. So there is plenty of room in the ventricle for another device. And
That's
so
clever.
So it leaves optionality again. The whole idea here is optionality for the user. Some people may never need another pacemaker.
Right.
Others, if they do, then at that point you can decide, do I use another leadless pacemaker? And going forward, that'll be the next generation, or maybe 2 generations from now. Or do I go back to a more traditional device because the needs have changed? So again, a lot of this is all around the optionality and what the patient needs at the time, recognizing their needs may have totally changed at that point.
That's a great point. If you're 85 years old and you've got a pacemaker that works for 17 years, you probably don't need
Yeah.
to worry about the battery.
If you look at Micra now and the population at large that gets it, about 80% of patients will only need one in their lifetime. So it's
It's
really looking at what happens to the other 20%.
That's very comforting to know. Now, a few months ago, I interviewed Dr. Natalia Trayanova, who's
Oh,
at
yeah,
Johns Hopkins Medical Center.
she's brilliant.
Yeah, she does lots of research on arrhythmias, especially atrial fibrillation. And she's basically created a program using AI to be more specific about atrial fibrillation, which improves the efficacy and safety and treatment of atrial fibrillation. Is AI being used in pacemakers, or will it be used?
Yeah, no, again, also great topic to go into. So right now, we have not put AI into the pacemakers themselves because of the desire to use as little battery as possible.
Right.
So where we're deploying AI is on the remote monitoring data platforms, so that we interpret information that comes from these devices, and also internally to help us with product design and evaluation. And the other places are quality surveillance. We have a whole system to make sure all these devices are working properly, and so that helps us as well. I think in the future, as the AI chip technology gets better and uses very little energy, that's when we will bring it onto the device. But we want to make sure that the benefit of the AI you bring to the device is worth the battery and the energy expenditure.
Right. Yeah, AI uses lots of electricity. Yeah, that's a problem. So,
Yeah. So
yeah.
right now it's perfect. We can use it for the data that comes out. But we'll get there as well.
Could there potentially be defibrillators that are this small as well for people who need that, where you could implant a defibrillator inside the heart, and if
Yeah,
they go into
because of the battery and capacitor sizes, defibrillators tend to be significantly larger. We're working on ways to miniaturize that as well. We did recently bring out a device called the extravascular ICD, which removes the defibrillator lead from the heart and puts it under the sternum, but that is still with the standard size device. So it's not the miniaturization you're talking about. There are projects working on that. It is harder in the defibrillation space, though.
right, it's a larger device, probably more energy needed as
Yes, much
well.
more.
But the Micra can monitor and see if there are any strange arrhythmias popping up. For example, if somebody just has a slow heart rate, like bradycardia, and then they start having episodes of ventricular tachycardia, will the Micra pick that up?
Absolutely. So it'll sense that, and on the remote monitoring or the in-office visit, physician can see that and then decide, do I need to change this device for something else, like a defibrillator, or do we need to consider an alternative therapy?
Right. What's your opinion of the new Apple Watches? They actually have sensors or detectors that can pick up arrhythmias, Apple claims. Is that reliable?
Look, we've done some work with that. We have an implantable device to do that detection. But I think more and more this whole space of wearable devices is getting better and better. I think the question becomes, for what is the right thing for consumer use, where you're just monitoring people where you're not at high suspicion or at less suspicion, versus a medical grade algorithm to detect. And I think it's important to understand the differences in the detection capability. In other words, if you had 100 people with arrhythmia, how many would you pick up with each of those? So I think first off, I think it's great that more ability to detect gets out to the public. And we've seen countless stories where someone will detect a slow heart rhythm that otherwise would not have come. They wouldn't have gone to their doctor yet, and they might have crashed a car or something, and it's picked up by a consumer device that gets to therapy. And that's terrific. I think what you have to balance, as you know, is you got to be careful that there's not false detections, because that can lead to a lot of care. So I think this will continue to evolve. I think going forward, we're going to see more and more ability to find problems. And then I think the issues will all be around, how do you sort out what's real and what's false? But I think it's exciting because what you want to do is you want to catch problems before they lead to a catastrophic event. And if we can leverage simpler tools to do that, great. I think that's wonderful.
Yeah, so the Apple Watch seems like a good screening device, but not necessarily medical grade. So if you know you have an arrhythmia or some problems, you don't want to depend on the Apple Watch. But as a consumer device, it's probably reasonably good for screening.
Yeah, at this point, that's what it looks like. Um,
So what's the future with pacemaking and what's Medtronic up to now that's going to make things even better and safer and easier for patients?
Well, you just hit it on the head, right? I think we're constantly looking at how do you make things better and safer for patients. And so what we're embarking on is a shift from the traditional approaches to pacing to either leadless pacing or this novel other approach that I mentioned, conduction system pacing. Why? Because both of them offer better ways to pace and better outcomes for the patients who get these devices. So with that then comes the capability of the devices and the tools to implant those um, uh, more effectively, quicker, and by more people who can do it. So, you think about the US, Europe, and places where healthcare is funded at a higher level, there are a lot of specialists who can do this. But we're also designing devices for all over the world where there aren't electrophysiologists everywhere. So we need to
Right.
simplify the ability for somewhere where there isn't an electrophysiologist to still be able to get this kind of therapy, and not, and democratize that as well. So we're going to see continued work there. I think the other thing we're working on, which I think is really exciting, is because either leadless or conduction system pacing is fundamentally a better approach. We think that pacing can be deployed beyond just treating slow heart rates. And so we've got a series of trials coming looking at other disease states where pacing could help. We don't know that yet, but we believe that's occurring. So we're doing ongoing clinical investigations, kind of randomized trials to understand, are there places where there aren't good therapy in the cardiac space, in the cardiology arena, where pacing wasn't felt to be helpful before, where we think it can be now. So I can't announce exactly what we're working on, but in the next few months, we'll be announcing a couple of clinical trials along those lines. And we have one going on now, actually looking at the ability of a pacemaker in someone who needs a pacemaker for a slow rhythm to also help with their high blood pressure.
Really?
So we think that these
Wow.
advances not only make it better for people with slow heart rates, but may also extend the reach of pacemaker over time. So it's an exciting time. I think in the next 5 years, we'll see, even though this is a 65-year-old space, I think we're going to see a step function in capability in the next 5 to 7 years.
Could you potentially put a sensor in your device to check a person's blood pressure, and then they can just see what their blood pressure is on their iPhone, just
So
like we're,
those are things being worked on for
wow.
sure.
What
Yeah.
about treating atrial fibrillation? Is that a possibility as well?
So, we have a whole division that works on the catheter ablation side. And I think that's kind of the dominant space for treating atrial fibrillation. I do think there are a good number of people where their atrial fibrillation is so entrenched that that approach doesn't work. And then pacing can help for those people. So I think it's, again, parsing out who benefits from what therapy is really critical here.
Right.
It's not a one size fits all um, therapy, set of therapies.
Right. So the original doctor and engineer who created the first pacemaker, Medtronic, if they saw what you're doing now, they would really flip out, I believe.
It's fun. Earl Bakken was really amazing person and set forth this concept of the Medtronic mission. And the mission basically kind of instructs us to continue to develop these products. I think he'd be amazed at what was done, but not surprised. I think he would just be proud of the fact that this vision of not resting on the status quo was continuing on even past his lifetime.
Good to know. So this has been extremely informative for me, and I'm sure even more so for the public out there who may not know that much about pacemakers and heart rhythms. And this is very important because if patients have issues like this, they know that they should see their cardiologist or electrophysiologist and get the latest in pacemaker technology. So thank you very much for taking time from your busy day to teach us about
It's been an absolute pleasure. It's, as you can tell, I like talking about all this
Yeah,
stuff.
yeah.
So, but no, thanks for having me on. It's been a lot of fun.
Good. Thank you very much.